Today I'm going to use the pathogen Human Papillomavirus, or HPV, to talk about health disparities and barriers to healthcare access in America. HPV is a sexually transmitted infection, or STI. One of the most common symptoms is genital warts. HPV can also cause several types of cancer. It can be years or even decades after you've been infected before you develop cancer. There are several ways to lower your risk of getting or dying from cancer as a result of HPV. People with female anatomy can have pap smears done by their OBGYN, and everyone can go have annual physical exams with their regular doctors. If an abnormal growth is found, it can be removed before it becomes cancer. Cancers, if detected early enough, can be successfully treated with chemotherapy. However, a lot of people, especially poor people, people of color, and people in the LGBTQ community, can face barriers to access, including a lack of health insurance or ability to pay even with insurance, a lack of sick leave to have the time to get treatment for precancerous lesions or cancers, a lack of specialty care nearby, such as obstetrics and gynecology or oncology in the area, distrust of doctors and medical establishments caused by centuries of mistreatment and systemic racism, inappropriate care or medical advice for transgender or non-binary people, harmful and disproven messaging that taking the HPV vaccine encourages risky sexual behavior in women, and a lack of education and resources, especially that's tailored for people in the LGBTQ community. These factors can have a big impact on someone's health. Black women, for instance, are nearly twice as likely to die of cervical cancer as white women in America. The recent COVID-19 pandemic is one highly publicized example of an infectious disease disproportionately affecting marginalized communities. However, many infectious diseases, as a result of access, education, and discrimination issues, affect different populations differently. HPV is just one example.